All right, hello. Welcome to the healthcare panel. My name is Perry Boring, and I'm the founder and president of the Chamber of Digital Commerce. We are the world's largest trade association that's specifically representing the blockchain industry and ecosystem. As we all see and as we all know, kind of the first movers in this Bitcoin and blockchain space very much was financial services. But as we're learning about additional opportunities to utilize distributed ledger technology, we're seeing the emergence of multiple other industries begin to engage in this discussion of how we're going to leverage blockchain and distributed ledger for other industries like healthcare. So I'm going to go around and have each of the panelists introduce themselves, name where you're from, and maybe just a quick kind of fun fact about what you guys are doing in this space. We'll start with Debbie.
So hello, my name is Debbie Bucci. I'm from the Office of the National Coordinator of Health IT. That's part of the U.S. Department of Health and Human Services.
Hey everybody, John Bass, founder and CEO of Hashed Health, blockchain healthcare innovation firm out of Nashville, Tennessee. Fun fact, one of our engineers is here and won the innovation award at the hackathon this past weekend, so that's pretty fun.
Congrats.
Hey everyone, thanks for coming. I'm Brian Smith, Chief Scientist at PocketDoc. We're, among other things, we are building an alliance and focused on pulling together industry stakeholders across essentially every industry vertical to enable blockchain in healthcare.
Hi, I'm Mike Jacobs, and I'm an engineer for Optum. Optum's a division of the United Health Group, and we've been working on blockchain for about a year and getting set to build up a team to make it into production.
My name is Chris Young. I head up innovation for Ascension Health. We're the largest not-for-profit Catholic health system, actually, in the world, I believe. We are exploring a variety of different use cases and things with blockchain, and are working with a variety of partners to see what we can do over the coming years to revolutionize healthcare via blockchain in a variety of use cases, which we'll talk about.
Great, thank you. So there's actually an incredible amount of activity happening within the blockchain and healthcare ecosystem. Being based in Washington, D.C., we've had the opportunity to do some really exciting projects with the U.S. Department of Health and Human Services. And Debbie's kindly joined us today to tell us a little bit more about how the government is participating in these discussions. Two main projects out of HHS. The first one was the Blockchain Challenge, which was completed last September. Raise your hand if you participated in that in any capacity. So a couple hands out there. This was very exciting for us to see at the Chamber, but it was essentially a call for information or research, white papers. They received over 70 submissions, was wildly successful, and so we took it one step further, and in last March, we hosted together the first ever blockchain and healthcare codeathon, and it was co-sponsored by the government. So it was the first time ever in the history of blockchain that a U.S. government agency actually sponsored a blockchain hackathon. So that was an amazing accomplishment for us as an industry, the Chamber, and also HHS. So Debbie, what did we learn through both the Blockchain Challenge, the call for research, and in the codeathon, in your role, in government? What did we learn from that experience?
So what did we learn from that? First of all, from the interest, when we first did a Google search about blockchain, there was a lot of hype about it. If at that time, the query was 3 spots. It was MIT, Estonia, and Philips. And so, first of all, the interest behind it were for over 77 submissions, and the tremendous interest about healthcare and all the work since then has been quite overwhelming. I think one thing, a big takeaway, at least from my point of view, is it's not just blockchain and the distributed technologies, but it's also the associated authentication, authorization, the other services, whether it's Web of Science of Things, all these other protocols and standards that actually will go into whatever the overall solutions. And I think that is a real unknown as where we're going. And I think that's a huge takeaway from at least the Codathon.
And so, what's next? What's a logical next step for the government to take?
So, there's nothing definitive yet, except that we do want to, ONC's, its purpose is around convening, and certainly we think that there is a spot to be able to bring different stakeholders in this area to keep both government, industry, policymakers informed about what's going on with blockchain. At least we get to the point that if somebody contacts ONC about blockchain, the first thing they say is, hey, there's Debbie. So at least to have that awareness that they can tie, that there's some technologies and that actually policymakers can understand or at least point to somebody, I think that's a good start in the right direction.
Yeah, well, actually, I guess there was a third opportunity, and just last week on Capitol Hill, the Congressional Blockchain Caucus invited both us and Debbie's team in to report to Congress and their staff about the activities happening in blockchain healthcare. So the awareness is happening. It's happening within the federal agencies. It's happening within Congress. It's happening throughout Washington. Let's talk about an industry. So I'll open this up to our technologist on the panel. When we talk about use cases in the healthcare space, we all know this is one of the most regulated industries in the world, very complicated, huge stakeholders between the pharma companies and your healthcare providers and the insurance providers. So sometimes we ask you, how do you eat an elephant one bite at a time? What are some of the low-hanging use cases or maybe the easier places to start in terms of getting blockchain technology into the healthcare sector?
Yeah, I'll take a shot. So at Hashed, we're very focused on easier, kind of meaningful demonstrations of value. So we're tremendously excited about the larger opportunities that the blockchain and distributed ledger technologies bring, and there's such an appetite and such a need for these solutions. But we can't change the world overnight, and it's really important that we demonstrate value in as reasonable a time frame as possible. So that's the trick, I think, right? Is like, how do you choose use cases that are pre-competitive or apolitical and kind of just solve a very discrete problem in a reasonable time frame, 2017, 2018, demonstration of value. And so I think there's a couple different areas where we're focused. We're focused mostly on B2B for the most part. We do have some very narrow consumer focused solutions, but primarily it's things that some would consider on the fringes of existing businesses, things like provider data management, provider directories, IoT, those types of use cases, supply chain. These are things that have a little bit of a head start outside of healthcare, and then folks like us try to figure out how do you take what's been done and what's been proven and then bring it in and learn from what's already been established and then put a healthcare wrapper around that. And so I think those are a few examples of places that we can make some progress in the short term while we build this foundation for the larger, more disruptive projects that will exist down the road.
I'd have to say that the low-hanging fruit isn't always obvious. So at Optum, we service so much of the value chain from providers to payers to pharmacy that we had our eyes were wide open with, oh my God, we could revolutionize the way healthcare can work, take a zero out of the cost of healthcare. But then some of the realities came into play that, well, in order for us to, say, accomplish automated adjudication of claims, we need to have all this other stuff working. And so getting down to something like provider data management as a prerequisite, just to demonstrate value, is a logical first step for a low-hanging fruit.
So we see at least 3 use cases. So I mentioned at the beginning an alliance that we've created. We've had 4 meetings with these alliance members, and in collaboration with all those industry stakeholders, we've identified 3 use cases. But really, there's something that's extremely low-hanging fruit in this industry, which is that according to a survey done by HIMSS about a year ago, about 1/3 of your healthcare data remain unencrypted, both at rest and in transit digital data unencrypted. So just implementing a system in which cryptographic security is table stakes, it's there at the beginning, to me is a great thing for us to accomplish out of the gate. And then identity. So knowing who someone is, knowing who a patient is at any point in a healthcare encounter. That's one of the things we actually solve for our customers today, not necessarily relying on blockchain, but I think using blockchain makes something like a multi-party identity authentication solution much easier to deploy.
So, Chris, you've been looking at blockchain in healthcare for, you said, at least 2 years.
Yeah.
So we've talked about some of the low-hanging fruit, some of the early stage use cases, POCs coming down the pipeline. Give us the long-term perspective. So let's fast forward this movie 5, 10, 15, maybe 20 years. What does life look like when the healthcare system is blockchain enabled?
So what I think is most interesting right now, and I won't ever comment on any of the technology because my colleagues here would have a good laugh at me even trying to do that. But I look at the companies and the organizations that are starting to come together just around the Blockchain Alliance, which is happening right now. And, I can't tell you who they are. I know who they are, but we've agreed not to, discuss that. But it's profound who's actually coming together to start meshing and working towards some standards. That's going to lead to a couple things. I think it's going to lead to a lot of things, the use cases you've talked about will get worked out. Identity management, yes, it's been solved for. Claims adjudication, all the things that hit clearinghouses, I think will get solved for. I think the more interesting thing is how the intrinsic value of information that should be owned by the consumer and can be owned by the consumer will come about to the point where they can control what goes where. So let me give you an example. If you were a type 2 diabetic that was 280 pounds, and you went on a diet, and you lost 80 pounds, and let's just say the diabetes went away, which does happen. There's an intrinsic value to that action. How we count for that and what we do with it as a system, the entire ecosystem is not really thought through now. But what's more interesting is what if we can actually see what that person, because that person allows us to, and they allow people to say, I'm going to let you look at what I purchase or a subsection of what I purchase around food. So if you're that diabetic and you've lost 80 pounds and you're eating and you're purchasing predominantly healthy foods as opposed to trying to think of something that I can't say that will get somebody mad at me, fast food that will kill you,
I'll say
you can do two things. One, you can do an intervention at that time, a real-time intervention, or two, you can put a value on the fact that this person is living a healthy lifestyle. I think that degree of visibility, if the consumer allows it, can put intrinsic value around the thing. We don't have that yet. The other thing is because you have these distributed bits of information that are all over the ecosystem that are not currently connected, and as much as I'd love for the interconnectivity to happen with the systems that are in place, it hasn't happened yet, but I do think the blockchain is the answer for that.
So it's very much about managing patient data and not just at the provider level, but also at the patient level, and giving patients or consumers the ability to own or have control of, in the Bitcoin ecosystem, we often talk about control of your assets, but it also can be applied to healthcare. And PocketDot is doing a lot of work on this. So what are some of the implications of a patient-centric data management system with blockchain and in healthcare?
Yeah, so there are many implications, I think. So folks are probably aware of HIPAA, one of the sets of regulations that govern healthcare data portability and transactions. And that's a bit of an artifact of third parties owning the data. So the consumer, in many states, sort of varies state to state. In most states in this country, you do not own your health record today. And so because third parties are owning the data, they are on the hook for ensuring that the data are secure and also, quote, portable, even though the portability thing is yet to happen. So when consumers own their data, I think there's a shift in liability from these third parties to the consumer. And I think that's a very interesting thing. So that means we have to empower the consumer with very good tools that include sort of user-centered design kinds of things to make sure that they know what it means to be giving access to their data. They know when it's happening. And ultimately, fast forward some time, using sort of computational agents to help them delegate access to the data in ways that are appropriate. So there's also the interesting opportunity to create markets for this information, and that's something that we're incredibly interested in and focused on, is allowing users, Chris brought up an example of this, so going back to his diabetic example, if we can actually prove that someone with diabetes has taken corrective action and they're able to share that data in a way that they can then monetize that information, we see that as a very profound incentive mechanism for affecting health overall and not just healthcare delivery. And so those are the kinds of things we're focused on that sort of user or that consumer ownership side of that asset.
So there's this compare-contrast where you're talking about B2B, which is highly regulated in the health industry. Then you're talking about data that's value added that really isn't clinically specific. So there's some opportunities, and also HIPAA regulations is once a patient gets their information, they're really consumer, and they do own it and what they do with that. So there may be some low-hanging fruit to be able to add that value-added data that's not necessarily health-specific as a early win, possibly, to have that other value to maybe a value to a patient/consumer. And perhaps blockchain might be a way to help a patient aggregate or a consumer aggregate some of that information.
Yeah, I think the key for that to actually happen is for some company to actually create the consumer place that basically enables the consumer to own their data and connects to everything that's relevant. Because if you can't do that, it's kind of a waste of time. But if you can, as you said before, if you can just make it easy for a consumer to understand, what data they actually have, because most people don't. They don't know. And quite frankly, a lot of your health record is not important. There's a lot that is, but is it really important what your telemetry was in an ICU stay 10 years ago on day 3? No, I don't think so. Now, it might be important that you were allergic to a drug that was administered to you, but really being able to comb through the data and say what's really important contextually at each phase of the encounter with a consumer, and it can be their day-to-day health management or it can be an actual clinical use case. If you can give that to them and really empower them and give them access to data, that's a game changer, because then they really own their record. Even if they technically own their record, getting at it right now literally is getting a photocopy. It's not necessarily a technological dump. Now, you might be able to get it in a lot of places through a great access to a portal, but that's not necessarily consumer friendly.
I agree, and I think it goes even further in changing how we think about healthcare and taking a more holistic view, right? So the idea of incorporating like social determinants data in with your health record will allow us to move beyond kind of this focus on sickness. Our friends in Nashville at Meharry Medical School have this motto that it's basically health is not the absence of disease. It goes much further than that. And so I think part of what we have to do is kind of hit the reset button on what we're talking about in a consumer focused in a community, healthy environments, healthy people, and all the opportunities to connect together different data sets that help us understand that in a more holistic way, I think is an important goal to think about down the road.
And it seems like there's going to be a lot of regulatory challenges if we're making, to me, this seems almost like a paradigm shift in the way we deal with healthcare. If you're putting the control in the hands of the consumer or the patient, that's a very different system than what we have today. So Debbie, how likely are we to actually get there, not technologically, but from a public policy perspective? Is this something that HHS has an appetite for, and do you see us getting there?
So there was an earlier session today, somebody brought it up, that there are policies in place that enable a patient to get their information now. But I think part of it, and you touched upon it, is perhaps there's a monetary incentive. Maybe consumers really don't know the power of having and owning their own information. Right now it's pretty complicated. If you go to 10 different doctors, you have 10 different areas to get that information. But there has been a lot of work out of HHS and the Office of Civil Rights to encourage patients to get their information and to download it and access to it. And I think maybe some more awareness could actually help around that.
Yeah, and let's be clear, it's not just about the consumer act or the patient owning their information about their own healthcare. It's about creating one record of truth. So today, we all have many doctors between your internist and your dentist and you name it. How do those records get consolidated against the various providers? Or if your internist sends you to another doctor, a specialist, how does that information get back? Mm-hmm. The reason why is you have one record of truth that's stored or that's organized through blockchain technology, which is controlled by the consumer. So there's an incredible, it's a data play, and it's a data management play. But in order for this to be seen, we're going to have to not only articulate what is the benefit to the consumer and the regulator, but also the businesses. So what is the value for business? What is the use case? What is the incentive for like a United Healthcare to actually move towards this one record of truth, patient-centered healthcare?
Yeah, so Optum and United Health Group in general has many facets of healthcare under its wings, and part of it is population health. And being able to have a consistent 360-degree view of a patient is going to lead to better care and reduced costs, especially around things like readmittance after being discharged from a hospital. It also will help streamline the entire consumer experience, not the patient experience. I think what we need to strive for, if we're talking about 5, 10 years from now, is when I go to a doctor and I have a service rendered, I would like to see the payment reconciled before I leave. I don't want to play the dance with the OBs and bouncing between providers and payers, and now I finally get the bill 3 months later. It's like, what was this for again? Really trying to find a way to find commercial opportunities to streamline the whole end-to-end experience from a consumer perspective.
There's huge waste in the healthcare system, right? So depending on who you ask, the estimate, I've got my own version of the estimate, but it's hundreds of billions of dollars in waste in the healthcare system. Great paper published 2012 estimates up to $600 billion in waste in 7 different categories. Today, CAQH, estimated $9 billion in cost savings just from removing manual transaction processing in the healthcare ecosystem. So $9 billion just sitting there waiting to be realized in taking out manual transactions in this antiquated industry, right?
Yeah,
so
that's just in the U.S., right?
And that's that's in the U.S., and that's only 7 of the 12 or so transaction types. It's the 7 most common of them, but still, it's about 20 billion transactions in which there's still $9 billion in cost savings to be realized just by eliminating manual transactions, right?
And it's not just manual transactions, it's also because there is not one record of truth of an individual's healthcare system or records. You also see a lot of duplication. So we've seen numbers as high as 30% of tests have to be reordered, either because another doctor's office did it, so this doctor's office doesn't trust this doctor's office, even if something as simple as a blood test. They'll recall it again, or the information just gets lost, or it's so complicated to get your healthcare record and information transferred from one doctor's office to another. They just order the same test over and over again. So we're seeing a lot of duplication as well because we don't have adequate data management systems in healthcare.
And to not put too fine of a point on it, it's healthcare. One of the assets we're talking about is human life, right? I mean, we're not talking about your bank account here. We're talking about life and death kinds of situations. And getting the information integrated and having access to it in a way that's easy for decision making is literally at times a matter of life and death. And so it's critical that we solve these problems.
Yeah, you know, when you say that, we're very focused on, part of our core mission is about serving the poor and underserved in our society. You know, we give about $1.8 billion in free care, and we are safety nets in our communities. But the thing that you see in the Medicaid population in general is you will see people moving around all over the place. They'll move from ER to ER. And as much as there have been some very good efforts to connect that data, it's not practical because you might have one system that brings all the data together, but then you actually have to do all your ordering in another system. So clinicians don't use it as effectively as you'd hope. I think if we have, with the rise of mobility and that cutting across just about every socioeconomic segment of society, we have an opportunity now with blockchain not only to do identity management, which is key, but start pulling all that together, all that information specifically in areas that are, you know, honestly poorly managed as a whole society. And there's a lot of waste. Just being able to take that out, I think, does a societal good fairly quickly. But we haven't really wrapped our heads around that. We've done these interim steps. We almost have to step back and think about how do we take a use case that not only aligns public policy, private policy, and all the private interests around a common core objective, and, you know, especially in a time when there's constrained resources around a Medicaid population, we'd be able to do some amazing good in this world, and it would have derivative impact for the rest of the payer categories.
So there's the opportunity to move this to blockchain, but there's going to be many different flavors of blockchain, many different ways of accessing it. So instead of having many different patient portals, you're going to have many different chains. So to be able to correlate all that information, then there needs to be interoperability between these exchanges. There needs to be a core identity that gets respected. So it's not just a matter of moving the information to the chain. It's more of the interoperability of those chains, I think, as well, for it to really work.
I agree there are going to be multiple chains, but at the end of the day, I think there are going to be a couple viable chains, and the rest are probably going to collapse. Because it's really about who participates on the chain, and seeing the collision of various parties who decide, yeah, we're going to work together because it makes sense from a business standpoint. I think we can work that out. I think
there's a big case, though, for having multiple options out there. And it shouldn't be one chain fits all. As individuals have different types of traits and flavors and things we like and prefer, companies, regulated institutions, governments have their own, you know, version and flavor of what they want to see. As an economist, and I'm not a healthcare professional, I'm an economist, one thing that makes a healthy ecosystem thrive is diversity and having options. So companies can say, okay, we have 10 different options to choose from. We're going to go this way because these are the types of, you know, these are our regulatory complications and obligations, so we're going to go this way. Other companies have other options. So there is a big case to have multiple options, as we all want, as consumers, we all want that. And it's also what creates a healthy ecosystem. And I do think interoperability is still a challenge, but there's a number of companies here represented at Consensus today whose entire mission is building out interoperability technology. So it's part of the technical challenge. I wouldn't necessarily see it as a hindrance to adoption, but you know, it kind of makes the case of this is not going to happen overnight. It's going to take the industry working with government many years to ultimately get to our end goal of creating this patient-centered healthcare system.
And certainly there's I sense the movement of pilots and proof of concepts, but there's not broad adoption yet. And certainly the promise is there, and the acknowledge that there will be multiple chains and there will be multiple ways, and there are companies focused on the interoperability of those different chains is promising, but it's going to take time.
The other promise is the fact that this is all being, for the most part, done on open source code that's fairly well documented. And I think everyone in healthcare is very worried that we're going to recreate the existing interoperability issues that we all suffer from today. And I'm an optimist here as well. I think there are a lot of really talented people in this building who are working on this problem, And we've got the open source community that's very involved, and I think documentation is good and getting better. So all of these things give us hope that we're not going to have this big interoperability problem in healthcare that we have today.
Yeah, I think what's interesting is the consensus conference is almost exclusively fintech. If the people, I think there's going to be a realization that there's a bigger opportunity in healthcare than there is in fintech soon. And I do believe people will come together and start leveraging the technologies. I don't know how quick it'll be, but there's just too big of an opportunity when you start looking at an ecosystem that's going to be $5 trillion in a decade.
And the other thing is we have a chance to really do a lot of good for people. I mean, this is not back office financial services we're talking about. We're talking about the opportunity to improve public health and global health. And I just, you know, it's something that once you start to understand the blockchain and the use cases and the technology and how that stuff comes together, you can't, it's almost, you have a more moral obligation to be a part of that community and to move it forward. So I mean, it's just an amazing opportunity we have, and it's a really unsustainable system that we have. And what else have you got, healthcare world? The solutions, you go to the HIMSS conference, you know, in Florida, and it's all, you know, it's all around the edges. All the solutions that are being proposed today, I think, are mostly around the edges and are not going to solve this $3.3 trillion problem, almost $5 trillion problem in the next 5 or 10 years. Blockchain is the only thing that's out there that I see as a fundamental solution for the massive waste that exists in these value chains that we're talking about. It has the potential to make more efficient these different market structures that we are wrestling with today. And so I think that's the great opportunity, is to create a new, some new infrastructure that enables machine learning, enables all these other great technologies that can also play a role. It's not the answer, blockchain is not the answer, but it is an important fundamental piece of the solution that we have to solve, not just in the US, but globally over the next few years.
We're actually addressing the multiple chain problem explicitly. We've got, you know, production code running on both Ethereum and Sawtooth, and we understand that those aren't the only two that we will probably have to support, but ultimately it's all, as you said, Debbie, ultimately it all integrates into an identity. And second point about this interoperability concern, this is one of the reasons, in addition to scalability concerns, why our system does not actually write the healthcare data itself into the blockchain. So we have pointers to the data, and so once you have the identity, and it actually doesn't matter what kind of blockchain it is, as long as it conforms to the standard of a pointer to the data and an identity, then you can actually access it transparently.
Yeah, that's a good point. We're not actually talking about storing patient data in a open.
God, I hope not. Yeah. No.
Sorry, and then there are some solutions out there that are testing and working with blockchain and that are open to different flavors of blockchain, but the core of the benefit of having it in a ledger to be able to reference, they're seeing advantages of it. And the other thing is, you talk about the use cases. I think that some of the papers that we got back around Medicare and especially Medicaid, the whole idea about eligibility is depending on your job and when you come and go, and the longest part is being able to identify, are you eligible or not? So certainly there are some value to be gained in using chain around that.
Oh my gosh, absolutely. I actually brought some numbers for my numbers math people out there. The Government Accountability Office in 2017, fiscal year 2017, has estimated that the waste in Medicare and just in improper payments, so like this issue you're talking about of giving people benefits that didn't actually fit them, was 10%, and that number is $60 billion a year. And in Medicaid, that number is more like 5.7%, so that's $17.5 billion a year in improper payments. So between the improper payments in both Medicare and Medicaid, it accounts for 62% of government-wide improper payment. So certainly a huge opportunity, and if we are able to utilize this technology just to address that one issue, we could save taxpayers and the government a huge amount in waste, fraud, abuse that we ultimately want to help clean up. We have just under 5 minutes left. I wanted to give the audience a few moments for questions. Do we have any questions? Yeah. You'll have to speak up. I don't have one.
We'll repeat
but
your
we can hear
question.
you. So I'll try to repeat the question best I can, but he's hinting on the kind of the issue of the healthcare industry has some very major players, and they don't always have, where is the incentive to actually make healthcare better? Whether it's, he mentioned the example of addressing diabetes by having a healthy diet, right? So getting off pharmaceuticals and using a better diet to address the issue. Will blockchain play a role, I guess, in that overall reform of the healthcare system?
So I'll take a stab at that. I'm a very cynical person who's a lot less cynical than you are. I have personally seen, I would call it a transformation in lots of industry players that are looking for alignment. They're looking, nobody gets up in the morning and says, how do we, well, there might be some people who say, let's just keep the status quo. But I think as people look at the economics and how it's not sustainable long term, we have both Social Security and Medicare, or the Social Security population is going to double by 2040. You have not enough resources, too much demand over time, and there's a big push toward fee for value as opposed to fee for service, and we're very much about that. I think that there are a lot of people who are looking in every single segment of healthcare, how do we do the right thing? And as much as I'd like to beat up on other sectors that might not be as aligned, the reality is I see a definitive push toward people trying to use underlying technologies. Blockchain itself is not going to cure, whether somebody is adherent to their medication or not. What it will do is give a tool to enable communication to a consumer in a much more robust way that deals with their underlying psychology of, fast versus slow thinking. So let me give you an example. It will allow you to say, hey, it knows you're at a place where you typically might eat something terrible for you. It might allow for an interaction to happen a lot faster. It says, okay, you can eat at this place, but you really need to think about the salad. Now that can be done kind of now, but how that information is transposed and turned into value is another issue. I think there are enough people working on how to actually move people to health. And our society, in a lot of segments, is getting healthier. People are aging in place much better than they ever have done in the past. When people hit 65, they're a much healthier group now, and I think that's starting to happen. It's not happening as fast as I'd hope, but I think there are a big enough wave of tools between IoT, machine learning, and blockchain. Those three things are going to come together in a powerful way to help make good things happen.
So I have a very specific answer. The companies you're concerned about are sitting around the table in the Blockchain Alliance, and it's in part because we are developing a protocol that explicitly incentivizes them to participate. A lot of this has been discussed here at this meeting. sort of the importance of the FAT protocol kind of thing. We've got those folks sitting at the table, and they are very interested in how it is they will develop new market opportunities based on the technology.
But I also think that consumers are going to drive, in the long term, I think consumers are going to be a big part of the answer to that question.
Absolutely. Well, we are out of time, but I think the panelists will hang out for a few minutes in case people want to engage directly. I want to thank Consensus and the CoinDesk team for putting together this event and for inviting us to be here today. And thank you for tuning in to everything about healthcare and blockchain. Thank you.